Welcome to In Your Neighborhood. I'm your host, Sharla Brown, and on today's show, we are talking with NorWest Community Health Centers. My guest today is Anita Jean. Anita is the Manager of Health and Social Programs. So welcome to the show, Anita.
Thank you for having me.
So tell me a little bit about the NorWest Community Health Centers and maybe a little bit of the history on how it got started.
Well, we've been around for quite a long time. We started as the Ogden East End Community Health Center, and that was back in 1990. We adopted a new name, NorWest Community Health Centers, in 2001 because we amalgamated with the Lone Lac site and the Armstrong site. We have this umbrella of services, essentially fully developed in Thunder Bay, the main site, Lone Lac, and we have a simpler range of services at the Armstrong site.
Okay, wonderful. And how long have you been working with the center, and how did you come about getting involved?
15 years now. It's a little over 15 years, and there was a job opening, and I didn't know about the center. Didn't realize the scope of services there, and I guess it really fits within the values that I have, so it's a wonderful place to be. We still have our original staff that started 25 years ago.
Wow, so that tells you a lot about the center and the organization, and you are the Manager of Health and Social Programs, so tell me a little bit about what you oversee and do.
We have a lot of illness prevention and health promotion programs, and we also have a lot of support for clients. So essentially the team that I supervise is community health workers, and we have community nutrition workers, and so essentially developing the strategy and overseeing the implementation.
Absolutely. And do you do that just for the Thunder Bay site or for all of them?
We have programs at Thunder Bay and in Lone Lac. And I also have some other functions, but it's a wonderful job.
Wow, I bet. Well, you've been there a long time, so that goes to say that you enjoy it for sure. So you've had a recent expansion over there, so tell me a little bit about what that looks like now.
Well, we've grown so much. 15 years ago, we had about, maybe 40 staff. We're over 130 now. Wow. And obviously, we outgrew our space. And the ministry, it was a lengthy process, but we essentially expanded more than twice our size. The expansion was 17,000 square feet. So it is a much nicer building in terms of having the space to see clients individually, also host a lot of other meetings with our community partners. So the construction was about a year, and then we moved in last October and had our grand opening in November.
Wow.
We've also had quite a few changes. We have our CEO of 20 years, Wendy Talbot, retiring in May. And though it was a national competition, our clinical director, Anita Lawson, was hired as our new CEO, so we're quite pleased about that.
I bet. So are you still in the same location? Was it
Yes.
was it an expansion or was it a brand new building?
Still located on Simpson Street, our main site, with the whole wing essentially attached to the old building. So that involved a move of every single staff over a weekend. But like I said, we have the space now. We have a lot of parking for our clients. So we've essentially taken over a block, the site of a block, and incorporated the shoemaker's store and called it the Shoemaker's Garden, so we can have some events outdoors.
Oh, that's fabulous. And that's a huge growth. You said you started with, basically 40 staff to now over 130. Is there just more demand in the community in terms of more health care needed?
Yeah, there's that, as well as more programs as we expand. For example, 2007 we established our mobile services. So we have this van transporting a team of a nurse practitioner, foot care nurse, and a community health worker to communities in the district. A few years later, we added the diabetes mobile. Then we opened we expanded our walk-in clinic to all Saturdays and Sundays. As we expand with these services, we essentially get new funding, and we get new staff, and we get more clients. Our capacity for services increases.
Absolutely, for sure. And let's talk a little bit about your model of care.
Well, So 40 years ago, Thomas Douglas, it was the whole Medicare, so we're looking at that in terms of it's not just primary care, it's not just treating illness, it's preventing illness, it's promoting health. It is looking at populations that might be having barriers to access healthcare, the clients that need some additional supports. So we have this whole model of health and well-being. We value things like accessibility, so this is why we have this daily urgent care in Thunder Bay. We have the mobile. We have essentially 25 points of access in the district of Thunder Bay.
Wow.
With our 3 sites, our mobile communities, and where we do the outreach. We want to have people learn the life skills that they may not have learned from their families, like how to cook, how to manage their money, how to manage stress, what to do to stay healthy, deal with things like health literacy in terms of being able to understand what will keep them well. So it is, we want to be culturally safe. So a lot of really good values into this model that all the health centers in the province are adopting.
Absolutely. And I think that's such an important point that you said in terms of, you might not have necessarily been taught those skills either at home or through school, through education. Mm-hmm. It's really great to be able to offer those life skills mm-hmm. to set people up to be more successful in life. And also, like you said, the preventative care, like when you know the things to do as opposed to dealing with something after you've been diagnosed, it's a lot better for sure. So why is the focus on social determinants of health important to your approach?
Well, if you are, for example, an Aboriginal female that is LGBT, lesbian, trans, or bisexual, your reality is going to be a lot more different than my reality, right? So where you live, secure housing, appropriate housing, access to healthy foods, having a proper income, a meaningful job, having some support. So those are what we call the social determinants of health. If you, for example, if you're poor, you will have if you have low income or if you're poor, your health will be poor. You're going to die earlier. You're going to end up in emerge or hospital twice as much, I believe, or to 2.5 times as much. According to the recent research, you are going to have twice the amount of chronic conditions that somebody else that is wealthier has. So we have to factor these things in. So for example, if we're going to show you how to, healthy eating, we have to consider that you might not be able to afford a lot of things, so that how to really optimize the budget that you have, how to cook from scratch or things like that, or eat seasonally, things like that. Or if you are, you don't have transportation, right? Or if you have chronic conditions and morning is not a really good time for an appointment, afternoon is best, or you have a lot of mental health and addiction issues, we have to factor this in how we care for you and how we plan our programs.
Yeah, and I think that's brilliant, and that the healthcare system is now looking at those things as opposed to, it's not a one size fits all. It's the fact of looking at everybody as an individual and how to best serve that person. Yeah, that's beautiful. Well, we're going to take a quick break, but we're going to be right back with Anita and talk more about the NorWest Community Health Centers.